Did you know about 50% of men between the ages of 51 and 60 have benign prostatic hyperplasia, enlarged prostate, and that number jumps to 70% among men aged 60 to 69 and around 80% of men over 70 years of age? Stick around because we'll show you how you can combat this naturally. In this video, we'll quickly go over what exactly is benign prostatic hyperplasia, BPH, what is the cause, what are the common symptoms, and most importantly, how to naturally shrink an enlarged prostate. Now, let's dive right in, but make sure you stick around until the end of the video as we include a bonus tip that might just determine your success or failure when it comes to shrinking an enlarged prostate. So, what exactly is benign prostatic hyperplasia? The prostate is a walnut-sized gland that rests below the bladder and in front of the rectum. It surrounds the urethra, the tube through which urine flows from the bladder, through the penis, and out the body. The prostate produces a fluid that is a component of semen. As men age, the cells of the prostate proliferate in response to the presence of a hormone called dihydrotestosterone. This causes the prostate to grow in size, resulting in an enlarged prostate, also known as benign prostatic hyperplasia, or BPH. The size to which the prostate grows is variable. In some cases, the prostate grows only slightly larger than normal, while in others, the prostate is greatly enlarged. While this is a benign growth, meaning it's not cancerous, it can cause problems. In particular, the enlarged prostate can physically press against the urethra and obstruct the flow of urine. In turn, the obstruction of the urethra can prompt changes to the muscles of the bladder, which can result in incomplete emptying of the bladder during urination. Now, you may be wondering, what is the cause? Well, we know that the hormone dihydrotestosterone affects the prostate as we age, but the exact science remains unknown. The journey into understanding hints at the interplay of aging, alterations in testicular cell dynamics, and the orchestration of testosterone levels. Interestingly, men who undergo early testicle removal, such as in the case of testicular cancer, seem to sidestep the development of BPH. These insights pave the way for ongoing research and potential breakthrough in unraveling the mysteries of prostate health. Now, let's briefly go over the symptoms and then jump into the solution. What are the symptoms? BPH exhibits various lower urinary tract symptoms. Effectively alleviating or even entirely reversing these symptoms is highly achievable by implementing the recommended step provided in the bonus tip towards the conclusion of the video. These symptoms encompass urinary hesitancy or difficulty starting urination, weak urinary stream, need to strain muscles to begin the flow of urine, urinary stream that starts and stops one or more times, inability to completely empty bladder of urine, increased frequency of urination, increased urge to urinate, increased frequency of urination at night, which often disrupts sleep, called nocturia, urge incontinence or the involuntary loss of urine, flow of urine slows to a dribble toward the end of urination. In severe cases, BPH may lead to kidney damage, bladder stones, hematuria, blood in urine, urinary tract infections, UTIs, and acute urinary retention, an agonizing condition marked by the inability to urinate, accompanied by lower abdominal pain and swelling. So now that we have a better understanding of benign prostatic hyperplasia, aka an enlarged prostate, let's focus on the most important part: how to naturally shrink an enlarged prostate. That answer lies in pumpkin seeds. Let me explain how and why pumpkin seeds are so effective when it comes to combating BPH naturally. Be sure to follow the bonus tip, as it dictates whether or not you succeed or fail based on this very simple step. Now, we went over how a proposed mechanism involves the accumulation of dihydrotestosterone, a potent testosterone metabolite, within the prostate, potentially contributing to its enlargement. But how does that correlate with the nutritional science of pumpkin seeds when it comes to BPH? Well, it all has to do with the phytochemicals found in pumpkin seeds, which are thought to exert a mitigating effect on dihydrotestosterone's impact, possibly impeding its conversion from testosterone. Pumpkin seeds are also packed with zinc, a mineral crucial for normal prostate function. A pivotal study revealed marked distinctions in zinc levels between healthy prostate tissue and tissues afflicted by malignancy or benign prostatic hyperplasia. Additionally, there was a discernible increase in urinary zinc excretion in cases of prostate health irregularities, further underscoring the intricate relationship between zinc homeostasis and prostate well-being. Now that you know this, how often and how much should you consume? Let's quickly reveal that in the bonus tip. Studies suggest that consuming about 1 ounce of pumpkin seeds per day will be sufficient for supporting prostate health. This optimal amount ensures you're getting the right balance of nutrients without overwhelming your system. The key to success lies in consistency, so make sure you consume that adequate amount for optimal results. For your convenience, there will be Amazon links for the top-rated pumpkin seed products in the description below. And if you enjoyed this video or got any value out of it, then hit that like button and subscribe to the channel. Thanks for watching.